I'm Margie SCHAPS. I'm the Executive Director of Health and Medicine Policy Research Group. I've been the Executive Director for 27 years, and before that, I was on the Board of Directors for 10 years. It's my enormous pleasure to be celebrating 40 years of this amazing organization. We have linked arms, the public sector, the private sector, our Board of Directors, and our staff in the quest for social justice through health policy and health systems for all these 40 years. It's been a remarkable journey, one of advocacy, one of policy development, one of convening groups, being the honest broker between government bodies and the private sector and the community at large. For over 20 years, I shared an office with Quentin Young. Quentin would walk into the office every single day and yell from the doorway, "What have we done today to fight the forces of reaction?" I carry that with me now every single day when I come to work, and I think about the mission of health and medicine and the work that we are all embarked on together, our board and our staff and our community partners, to fight for social justice in health.
We write op-eds. We make it our business to get in the media, to express ourselves in church groups and labor unions and other civic groups. In a word, we think we are exemplars of the democratic process to take a social problem when it reaches a certain magnitude, do the education that has to be done, then do the advocacy, and ultimately see social change.
I think the most interesting thing about health and medicine is that it's really a Chicago type organization. You can really tell where our roots are from. We're the kind of organization that Quentin Young would invent and start. And so we concern ourselves with issues of the day, issues that really matter to people, not only in the Chicago area, but around the state and around the country. In my mind, it's really these crises, these problems, these human tragedies that ignite our board and make our board passionate about trying to improve healthcare for people in this country.
So we dreamed up health and medicine as a way to provide an opportunity for Quentin to come out of Cook County Hospital and provide the kind of leadership that only he could provide, right? To pull together the interests in the city who are now all sprinkled around and not very effective or connected, and develop a force for justice in the field of health and medicine. Chicago needed something that brought people together around better health and an increase in equity and justice.
I called together a number of friends in the health policy and advocacy field to start a new kind of organization. Health and Medicine Policy Research Group is the product of that, now 28 years old. This organization has many achievements addressing special problems of the poor and underserved. It's become an honest broker in dealing with health problems and achieving their resolution. And the people in the group work and work hard, and I'm very proud of this achievement because it's made a difference in this city.
At Health and Medicine, we do our work in lots of different ways. We work on projects that take decades to complete, our freestanding birth centers or community health workers. Health and Medicine's been invested in the creation of a pathway to certification and reimbursement for community health workers for over 20 years. So we're in programs and policy for the long haul. We're also there to be nimble and be very flexible when there's an immediate need, as there was over the last year and a half with COVID. We jumped in to support many efforts at the local and state level to support efforts to address COVID from a policy perspective and from a programmatic perspective. At Health and Medicine, we are always looking for ways in which the lens that we bring can have a real impact on health. For example, in 2011, when we learned about the Adverse Childhood Experiences study and the impact that childhood adversity can have on long-term health, on engagement with the carceral system, on educational attainment, I embraced that and thought, we need to address that. Health and Medicine needs to put its lens on adverse childhood experiences.
My name is Lon Berkeley. I'm one of the founding members of the Health and Medicine Policy Research Group. There are 4 principles upon which we decided to try and create a new organization. The very first was the fact that the impact on health was a lot more than medicine, and we wanted to emphasize that by even including in our name Health and Medicine Policy Research Group, the fact that we had to be broader than just the medical field. A second key principle was that we didn't want to just be a think tank. We wanted to be an action tank and combine our ideas, our research, our development of new policies, to also combine that with efforts to implement those new ideas and policies. So we tried to be an action tank as well as a think tank. A third key component was the fact that we did not want to be beholden to any particular funding source. We wanted to be independent, and we wanted to be able to be flexible, we wanted to be able to be innovative, we wanted to be able to be opportunistic, and therefore we did not want to specifically only respond to wherever our funding sources were. A fourth and very equally important as the other three was the fact that this was going to be driven by the board of directors. It was not going to be a staff-driven organization, but we wanted the board to be made up of individuals who could bring new ideas and encouraged to do so, and to begin to maintain a balance between getting the work done and being innovative in those ideas.
My name is Jen McGowan-Tomke. I am a board member of Health and Medicine Policy Research Group, and I serve on the executive committee. I have been a board member since 2015, and I joined Health and Medicine to really expand my connection and engagement with health policy in the city and the state. One of the reasons I became involved with Health and Medicine is because of the unique relationship and work that happens between board and staff. Health and Medicine is a working board. You know, if you're involved with Health and Medicine, it's about, getting your hands dirty and being involved in the policy and in the work. And it's such an amazing opportunity to get to know staff and really work hand in hand on issues that are so important to us as a community.
My name is Kirsten Smith, and I'm a senior policy analyst at Health and Medicine. As a new staff member, I've been continuously humbled by the sense of community, inclusivity, and professional support that's foundational to Health and Medicine's approach. From day one, I've been encouraged to bring every aspect of my identity to the work that I support, as well as leverage my lived experience with the same fervor as my professional skill set. As a Black woman who's found myself in many rooms and at many tables throughout my life, I can truly say that I applied Health and Medicine not only for its strides to further health equity, but also for its ability to maintain true equity within the workplace.
When Health and Medicine began in 1981, we were strictly a policy advocacy organization. In 1996, we embraced an additional model for Health and Medicine, and that was the on-the-ground Chicago area Schweitzer Fellows program, where we engaged with 30 young health professional graduate students every year to help expose them to health policy and expose them to working with marginalized communities throughout the Chicago area. That has been an enormous addition and wonderful partnership for Health and Medicine, bringing practice experience to our policy and advocacy work and informing the Schweitzer Fellows program and the on-the-ground work of the fellows with the policy advocacy strength of Health and Medicine.
My name is Ray Mendez, and I'm a family physician here in Chicago. I joined the board a few years ago after completing my Schweitzer Fellowship. One of the things I love about this board is that it's comprised of a large group of intellectuals who have a lot of experience working in the healthcare field and addressing issues like systemic racism and other inequalities. The group really does a great job of putting it all on the table and discussing it in a way that's respectful, but also very impactful and effective in creating policies that we can support to try to really change things for the future.
I'm Wesley Eplin. I'm the Policy Director at Health and Medicine Policy Research Group. The thing I value most about working at Health and Medicine is our focus on the structural causes of health inequities. Whether you look at healthcare, housing, or education, many policies stratify the resources we need to be healthy and deny people of their human rights. Money, power, and resource stratification causes people to get sick and to die years, if not decades sooner than they otherwise would. Health and Medicine helps grow the health equity movement to overcome the structural inequities and the vested interests who benefit from them. We apply this to all of our areas of policy that we work on, whether healthcare, public health, social determinants of health or the health workforce.
I also think that health and medicine has a great foundation or platform for having policy conversations that might not be happening in other places, and where there may be opportunity to engage in things that are just a little more progressive or outside of the box. For example, health and medicine has hosted conversations around safe consumption sites for people who use drugs, which was an opportunity for many advocates and practitioners to come together and think about this issue as an emerging topic and figure out where strategies could be applied and what we could do together.
I'm Steve Rothschild, and it is my privilege to be the president of Health and Medicine Policy Research Group. During the day, I am the chair of family medicine at Rush University Medical Center, where I am in practice as a family physician. My involvement with health and medicine goes back to the early days, although health and medicine didn't know that at the time. I was a resident in family medicine in Cleveland, and someplace along the way I picked up this magazine that Health and Medicine Policy Research Group produced. And I was just learning, but man, the work that that organization was doing, and this guy, Quentin Young, its founder, was advocating for, was something I wanted to be involved with, something I aspired to. This organization has never disappointed me, because we are an honest broker. We convene members of the public, stakeholders on critical health issues facing Chicagoans, and we gather their voices and we advocate for the health of the public. One of the things that work allows us to do is to criticize when it's necessary. Quentin, as many of you know, did not shy away from a fight. He relished a good fight, perhaps even more when it involved our friends. Because you knew where Quentin was coming from. Right? It was all about everybody in, nobody out. Health and medicine, I believe, continues that tradition that Quentin established. Even after we advocated for and supported the creation of an independent board for the Cook County Health and Hospital System, an independent board that we still believe in deeply, we've not been afraid to criticize when that board was politicized or when the board missed the mark. That's accountability. That's the responsibility we have as an organization, and that I hope has made us a trusted partner in Chicago.
Hello, my name is Michael Gelder, and I'm one of the founding board members of Health and Medicine Policy Research Group. I'm really honored and pleased to be invited to share my thoughts on this exciting 40th anniversary. What I really like about Health and Medicine Policy Research Group is the fact that it's a learning organization. It's been that way from the very beginning when we had a group of young active board members. And how we learn and what we learn has impact throughout Chicago and in this case throughout the state. And the case I'm talking about is long-term care. When Medicaid first started, it was exclusively paying, reimbursing states for their expenditures on nursing homes. As it evolved, we learned that people didn't want to be in nursing homes and could be cared for at home safely. And Health and Medicine teamed up with a variety of local organizations, community-based organizations and unions to make home-based care the norm in Illinois. Rather than nursing home care. And so at some point in the 90s and the early 2000s, the balance shifted so that we're now spending more on people who are staying at home by employing people from the community, sometimes even their own friends and family, to provide that care. And Health and Medicine as a learning organization is able to do that because we learn, we're quick, we're nimble, and we listen to the community, and we provide the policy analysis and research and bringing organizations together in a way that helps us accomplish a much broader purpose.
My name is Claudia FEGAN. I am the past president of Health and Medicine Policy Research Group. I attended my first health and medicine meeting in the spring of 1989, shortly after I had joined the practice with Quentin Young. And I had been working on a speaker's training to teach people how to talk about access to health care and improved Medicare for all. And we collaborated between Physicians for a National Health Program and Health and Medicine to have a speaker's training. Over the years, I think that health and medicine has sold themselves and actually borne out to be the honest broker when we bring people together with differing opinions to talk about those subjects that people want to argue about. We have heated discussions, but we base our discussions on reality and facts instead of the popular sound bites that everybody feels are the arguing points. We need to get to the root of the matter, and health and medicine has always provided a platform to do that. I'm proud to be a part of the organization.
And the thing that I really like about this organization is that it's really dedicated to Quentin's vision. And that was that we needed an independent organization that was willing to address the hard issues and really have the long and difficult discussions that we need to begin to understand the problems that exist in this country. And certainly with this present pandemic and the recent elections and the George Floyd murders, we have lots of issues that have been going on in the country for centuries that we still haven't come to grips with. And what I really enjoy about health and medicine is that in our area, regardless of what your political position is, health and medicine is seen as a go-to organization which is willing to sit down with people from all different points of view and have those arguments.
I am so proud of what health and medicine has accomplished over these 40 years. Our board and staff and all of our community partners together have done so much to improve the lives and the health of Chicago and Cook County and the state of Illinois. But there's so much more to do. We all need to continue to link arms. We need to continue to develop policy and programs to improve the lives of everyone. I want to say thank you to all of you, all of our partners, to our board, to our staff, to those of you who support us, the individuals and the foundations. We appreciate you so much, and I hope you'll stay with us. We have so much more to do in the future, and we need all of you as our partners. Thanks again.